All right, it is just about 11:30, so we're going to get started with today's presentation. I want to say a really wonderful thank you to Traditions at Longwood for having me do the presentation today on quarantine. Traditions at Longwood, I hold a very dear place in my heart for because it's also where my parents live. So certainly I've gotten to know a lot of really wonderful folks from Traditions through my parents, as well as through our practice now being located in Kennett Square. So a special thank you to the community. Very, very excited to be partnering up today for this presentation, since our lectures in the past have really been so rewarding to see what an engaged community you have. So today we're going to be talking about quarantine, a topic that certainly all of us are holding near and dear to our heart, and really looking at how our body is affected by quarantine. For those of you who don't know me, my name is Kristen Wilson, and I am a physical therapist and co-owner of Action Potential. We have a practice here in Kennett Square now as of February, and we also have a second location located in Glen Mills. And we just celebrated our 9th anniversary of being in business. So certainly this year has provided a lot of challenges as a small business, as you would imagine, but certainly nothing when compared to the challenges that I'm seeing on our community members and the physical effects that we're seeing. So today we're going to talk about how we can understand those physical effects, as well as, most importantly, mitigate those effects and improve our bodies so that we can really come out of this unfortunate quarantine on the other side with a very strong and supported system. So really we'll start today by going over some of the COVID-19 quarantine effects, both from a societal perspective as well as how those effects affect the body. We'll talk a little bit about the normal aging process and then how quarantine has exacerbated some of those symptoms and processes. And then lastly, I'll provide you with some recommendations on things that you can do both during quarantine as well as once we kind of open back up after the vaccine is out and everyone is back to their normal lives, to help remedy those side effects and all of the issues that you may have experienced or are experiencing. So let's talk first just about a couple of facts related to quarantine. Certainly, we know that in March, when things shut down, we had about that 3 to 3.5 month period where Pennsylvania was really almost completely shut down. No restaurants, no shops. And that was kind of what most people consider to be quarantine from COVID-19. However, when we look at the effects of physical decline and how our bodies have been affected, we see that that really carries a timeline that extends even until today here in December. So here we are, October, December, we're still restricted. So now we're, 7 months in, 10 months into this process, and we're still in a period where our body hasn't quite remedied how to handle not being used to our normal lifestyle. Certainly, when we look at the CDC, we see some identifiable risks in terms of populations. And the first is older adults, those over the age of 60. So as we talk about some of these changes, when we get to the normal aging component, I'll highlight why the older adult is at more of a risk. And that's because of some of these normal age-related changes. And then certainly, if you happen to be a person with certain medical conditions, then you would also be at higher risk for further exacerbation of the sedentary lifestyle effects. And that would be if you had something like chronic kidney disease, COPD, obesity, if you were immunocompromised, maybe you're going through some cancer treatment or are on any kind of immunocompromised medications, serious heart conditions, any sickle cell problems, as well as type 2 diabetes. And particularly that last one we know is very, very prevalent in the United States. And we see that those with type 2 diabetes have a harder time recuperating from the side effects of quarantine as well as of COVID-19 itself. So when we couple all of that together, we really see this kind of mishmash of cumulative effects. We see that those who are at increased age are at increased risk for having problems. So they have to take increased precautionary measures, which in turn increases that length of quarantine, because now we recognize that you have to take those safety measures. It might not mean that you can return back to normal life, where a younger person who isn't at an increased risk, who has a relatively healthy history could potentially take some other risks and get back to some of the normal daily activities. So it creates this unfortunate cycle because as we go along with quarantine, we see that that's going to increase the side effects on our body and thus put us again at an increased risk. So it's this terrible downward cycle that we have to address and almost nip in the bud as best as possible. So, in working with clients over the past 9 months through this whole process, I've heard a lot of people's takes on what they've done during quarantine and what they could have done during quarantine. And this is more of a little bit of a tongue in cheek slide to share with you kind of some of those experiences that I've heard. So a lot of my patients have told me what they have done is things like, binge watching their favorite show on Netflix, or maybe watching a couple of old movies that they haven't gotten a chance to see. Certainly taking up some cooking and baking and really getting involved in the kitchen, taking up an instrument. Maybe they adopted an animal. They cultivated some of their green thumb and maybe did some outdoor, indoor gardening. Did some virtual museum visits where they could kind of go and check out some museums in a virtual format. Tons of organizing and house cleaning. I think that that's been one of my catharsis moments, is going through all my old closets and getting things cleaned out and really, tidying up and doing some of those home projects. Reading, certainly I've heard a lot of readers. Crafting, getting into some new DIY hobbies, and then lastly, some Zoom gatherings, much like this one, whether it's for a learning purpose or a social purpose. Just finding unique ways to spend time. But I've also heard on the flip side what things people wish that they would have done or wish that they would start if they could get the motivation to do it. And that's things like exercise, getting out and doing a walk or doing a daily exercise, doing some video exercises, entering themselves in some kind of a competition, whether it's a race or a virtual exercise competition with friends, getting up and moving more during the day. And one person even said she wished that she would have danced during commercials because she's been watching so much television. So when we look at those, what we did versus what we could have done, a lot of those could haves revolve around that idea of physical fitness. And we're going to talk a little bit more about why we've kind of sideburnered those physical fitness activities. Certainly for many people, they may not have had COVID-19, but they still feel like they're not quite themselves. So they didn't necessarily get sick and have the virus, but they have these other weird side effects from the inactivity and the lack of engagement that quarantine has brought. So some of the most common side effects that we see as a result of the COVID-19 quarantine and change in activity is things like pain with exercise. So people will say, I try to get up and move, but it's kind of painful because my joints are so stiff from not moving. Or maybe it's just pain with daily tasks. I find that I'm not able to do the things I need to do because things are just achy and painful. My joints have really started to act up. Certainly another one is people are reporting that they have more losses of balance, whether it's with exercise or with daily tasks. They're finding that they're stumbling more or having more of an issue with feeling safe and supported. Certainly shortness of breath with light activity. You throw a mask on top of that and go out for a walk in the community or maybe run out to the store, and people are feeling that shortness of breath significantly more than they used to. Feeling lethargic. I know that this is one that I commonly hear a lot of my patients share, and I myself have had often times where I feel just kind of like blah. I don't want to do anything. I just feel lethargic. I don't have the energy that I want. Certainly, we have to look at the mental health component with anxiety and depression. So really that feeling anxious or worried, as well as just kind of feeling down and kind of out of it. Those are very, very typical complaints these days as we see that significant change in both physical activity as well as socialization and interaction with our colleagues and friends. So, this presentation is about saying enough is enough. We know that there are things that we can do to help mitigate some of those negatives that we saw on the previous slide. And my job today is to teach you a little bit about what are the things that are normal age-related changes and what are the things that we can actually have an influence on in regards to quarantine. So we're going to talk about those normal changes so you have a good baseline, and then talk about how we can incorporate some physical activity to help mitigate those effects so that we can prevent changes in our muscle and bone bones, our endurance, and our balance. And then most importantly, in our overall well-being and sense of how we feel about ourselves. So let's talk first about some of the normal age-related changes that we see, particularly in muscle and bone. And it's important just to understand this information. This may not be the most exciting thing for you to learn right now, but I do think it's important, particularly when we then parallel this with a change in activity level that we've seen recently with this shutdown. So certainly with regards to muscle and bone, we see that as we get older, naturally, without any kind of diseases being present, we're going to see a decrease in the size and type of muscle fibers. So what that means is that if you were to maintain a normally active life, as we go through a normal aging process, our muscles are going to get a little bit smaller. And that's in regards to a small change in physical activity, as well as some changes within the muscles themselves. And we see that the muscles themselves start to lose their ability to be explosive and fast, and instead have fibers that are a little bit more slower in nature. And this is because as we get older, we stop doing some of those explosive fast movements. It's not often that you see someone going out for a sprint in their 60s, 70s, and 80s, whereas certainly a child or a young adult might go out and sprint in order to, go chase the dog or as part of a sporting event. So certainly we see that the muscles themselves get a little bit smaller and become a little more slower in their reaction. We see that there's significant dehydration of the spinal discs and the cartilage of the body. And this is important to note because this is part of what leads towards that idea of arthritis and degeneration within the spine and the joints. Cartilage provides a really spongy shock absorption at the end of our bones and between each of our spinal segments. And when that starts to dehydrate, it loses its sponginess and becomes significantly firmer. And so what we want to acknowledge is that those morning aches and pains in the joints and the spine are part of the normal aging process, as long as they're not hindering your ability to do things throughout the day. Certainly, we see a decrease in bone density as we get older. Often we see this most predominantly in females who are often diagnosed with osteoporosis or osteopenia. However, that's not to say that males don't also experience a decrease in bone density. This can certainly be offset with good weight resistive strength training, and we'll talk about that as we go through a couple slides in the next couple minutes. We see a decrease in metabolism of the muscles as they are using oxygen and nutrients to be able to do normal daily tasks. And what we see as a result is that the muscles themselves don't have the endurance to be able to do something like a prolonged walk, or maybe it's lifting multiple objects off the floor, carrying in heavy groceries. We see that those muscles actually lose their ability to sustain those tasks for longer periods of time. Most commonly, we see that the hips, ankles, and the spine are most affected in regards to changes in the bones and the muscular system. And so as we think about some of the recommended tasks that we'll talk about, we're going to focus those tasks on these three key areas. So when we look at these normal age-related changes, we can see how this could lead to some problems like an increased risk for falls, an increased difficulty in performing daily tasks, as well as a general slowing of all of our movements, including walking, either around the house or out in the community. And as we talk about how quarantine further exacerbates these, I'll share with you some strategies to help improve all of these situations. In regards to endurance, we certainly see some normal changes that occur within the body. Again, that's not including any kind of pathology or diseases that you might have or any sicknesses. But what we see with normal aging is that there's a decrease in the efficiency of the heart. The heart's not able to keep up with its activity level as well as when younger. And that's partly because it's not getting the same demand or the same activity level. We do see that there's some changes within the valves of the heart. In between each of the four chambers of the heart, there's little valves that open and close to allow the blood to move through the heart and through the body. And as we get older, those valves can start to break down and have difficulty opening and closing. And this can cause some changes within how our heart pumps the blood into the body. We do see some heartbeat problems and irregularities, most notably atrial fibrillation, or AFib, is very common amongst older adults. And this is where the signal between those four chambers of the heart is disrupted, and we start to see that the heart behaves in a very irregular pattern. We see some increase in stiffness of the thorax or chest wall. And this can become a result of tightness within the muscles and the ligaments and cartilage within that chest wall. So now, instead of having a really flexible rib cage that can open and close with breathing, our chest wall starts to get very, very tight and tense. And then lastly, we see a thickening of the membranes within the lungs. And this usually presents itself with having increased mucus within the system and a lot of expectoration because of that thickening of the membranes of the lungs. That mucus clogs the ability for oxygen to get out into the lungs and therefore out into the system. So some of the endurance related activities that I'll recommend in a couple minutes will help to maintain that flexibility of the lung and rib cage so that we have optimal oxygen coming into the body. As a result of these normal changes, we will see an increase in shortness of breath, as well as an inability to complete daily tasks because of fatigue. And the body starts to feel like, oh, I can't keep up with my normal tasks. And then lastly, we see that these types of changes will actually make you more likely to have a sickness, as well as a slower recovery from a sickness. So we want to make sure, especially in this time where sickness could be prevalent moving into the winter months, that our body is prepared so that it can recover very, very effectively. Now, the last system that we'll talk about in regards to normal age-related changes is the balance system. And, many people think, well, as you get older, you're just supposed to lose your balance. That's part of normal aging. That's not actually the case. We do see that there is a small decrease in the ability to regain the balance because we stop doing some of those tasks that challenge the balance system. So for instance, I know this past weekend we decorated our Christmas tree, and I got up on a step stool to put the star up on the top of the tree. Well, oftentimes as we get older, we stop doing tasks like that because of that risk for falling, and our body responds by almost eliminating those balance systems. So really what we want to do is make sure that the body maintains access to all of those balance systems by challenging it in safe ways. Most commonly, I see that people have the most difficulty regarding balance when they're doing things like walking outdoors on the grass or gravel, or particularly in the wintertime as it gets snowy and icy. When they're doing things around the bathroom, whether it's stepping in and out of the shower or getting on and off the toilet, or when they're bending over to pick something up off the floor. So most of the times when someone has a fall and they come in for physical therapy, I'm hearing that one of those three avenues or causes was the culprit for that instability or loss of balance. Certainly the reason we're so concerned about balance is because there's a very, very high risk of injury. Most notably, broken hips are the #1 result of a fall. Head injuries, so you fall and hit your head, and that can cause some type of a brain disruption. And then lastly, a broken wrist, because you put your arm out to stop yourself from falling and end up breaking those bones as a result of decreased bone density. The reason that I'm so passionate about balance is that it creates that cycle of falls. So you can imagine if you're feeling unsteady, that's going to lead to not wanting to do too many different tasks. Once you stop doing different tasks, we start to lose strength and endurance. Once we lose strength and endurance, our body now can't recover from a loss of balance. So we start to see this downward cycle of an increase in falls as we stop doing things because of a fear of falling. So my job is to educate people on how they can break that cycle of falls and maintain optimal experience with their body so that they're able to mitigate those problems and forgo having any type of a negative consequence. So we've talked about, what happens, what people are feeling during quarantine. We've talked about the normal age-related changes. So now let's talk about, what should I do in these later stages of quarantine and as I enter into the winter where I might have a further reduction in activity because of weather. So now we've got quarantine, we've got weather, and then we've got the history of having had a whole year, almost an entire 2020 of decreased physical activity. So these next couple of slides are my recommendations on how you can help to stay ahead of things, as well as remedy any negatives that you've already seen in the past 9 months. So certainly we're going to talk about how can I strength train to decrease pain as well as improve my functional ability to do things around the home. How can I improve my balance so that I'm not feeling fearful? We'll talk about ways to mitigate shortness of breath so that you don't feel like those light activities are making you feel like you're huffing and puffing. And then lastly, we'll talk about exercising with friends so that we can improve that sensation of anxiety and depression, because we know that group exercise and coupling your exercise goals with someone else helps not only physically, but it has dramatic effects on your social well-being and your mental well-being. So let's talk first about strength training. And certainly I know that a lot of people are very hesitant to start strength training because they're not really sure where to get started or what the benefits even are. So really, when we talk about strength training, this is moving your body against gravity with or without the use of additional weight. So in many cases, you can get a very good strength training workout just by using your own body structure. So, when you're moving in and out of positions against gravity, you're strength training by using the weight of your own body. We can also add some extra weights to that, and I'll share with you a couple different ways to do that. And that helps to provide support to the structures of the joints of your body. If you think about it, every joint, every group of bones is surrounded by muscles that make those bones work. And when we strengthen the muscles, that helps to allow those joints to move and flex in the right kind of way. In addition to that, strength training helps to improve our overall posture so that we can maintain good flexibility of our spine and our rib cage and carry our body in the most safe way possible. So the best way to do strength training is to emphasize exercises that you perform in standing. So certainly the best way to do that is finding a safe environment where you can work and then going through a couple different exercises where you have the opportunity to put your hand on a surface if you need to. Doing exercises in standing is more beneficial than doing exercises laying down because now we're using the weight of our body against gravity to strength train those muscles. When we talk about the exercises to do, I want you to think back to that slide where we talked about what were the muscles most affected. And those were the muscles of the abdomen and spine, the hips, the ankles, and the shoulder blades, which are the connection of our arms to our body. So the exercise examples that I've provided and will share with you at the end of this lecture target those areas because these are the areas that we most want to build strength and stability in. When we're doing our strength training, we're going to use our symptoms as our guide. So if things are hurting, then certainly you're going to want to either seek professional help or stop that exercise and get some feedback. We're also going to use fatigue as a way to guide our symptoms and our exercise intensity. And we'll talk about that in a couple more slides. So my favorite examples of strength training exercises that are very easy to do in the home are a squat, which is shown in this photograph here. A squat is a beautiful exercise because it simulates getting up and down from a chair or a toilet, which is something that if you think about it, we do that numerous times throughout the day. So we want to make sure that we maintain the ability of our hips and our legs to lift our body against gravity so that we can get on and off the couch, get on and off the toilet. A row is a motion where we pull our arms towards us. This is a spectacular motion for things like lifting up off of the ground, maybe a laundry basket, or maybe you're planting flowers and you want to transplant that beautiful Christmas poinsettia into a new pot and you need to lift it up off the ground. So that activity of pulling towards you or rowing is a fantastic way to strengthen the muscles of the back and the shoulder blades. And then lastly, a step up. And I know in traditions at Longwood, many of the models have a loft and a basement and or a basement. So many people still have access to steps or a step, even if it's just one step getting into the house from the garage or the front door. And going through a step up motion where you step up onto a step is a really wonderful way to challenge not only your balance, but to strengthen all the muscles of the legs, including the ankle muscles. And I've shared each of these with you at the end in a downloadable PDF, which I will show you in just a couple minutes. Balance tasks, certainly we know that if you don't use it, you're going to lose it. And we want to make sure that you're able to maintain your balance through this time, because as we're spending more time on the couch or doing more sedentary tasks, our bodies aren't getting that experience that they need. And we want to make sure that we can have confident and fluid movement to prevent any kind of a fall. So the tricky thing about doing balance tasks is that we have to make sure that they're done in a safe environment where you can hold on to something, or where you have your back in the corner of a room so that if you fall, you can put your arms out and have the ability to hold on to the wall. The problem with balance tasks is that in order for them to be most effective, they have to be challenging enough where you feel like you're losing your balance. Well, you can imagine my hesitation in recommending doing something that's going to make you lose your balance when no one's there to help you, because I don't want anyone to have a fall. So in a lot of cases, true balance retraining requires the skilled intervention of a physical therapist to help provide a safe environment where you can be challenged outside of your typical comfort level. With that being said, I do always like to share one balance task, which I've included on the downloadable PDF. And that's the one here on screen, which shows standing on one leg. So in order to do this safely at home, you're going to want to hold on to something like a kitchen counter or the back of a sturdy piece of furniture or banister, and then stand on one leg, and then just gently remove your hand from that surface, just momentarily. And you want to make sure that that hand stays close, because if you start to lose your balance, you can steady yourself and not have a fall. I do always like to share that in order to be considered normal for balance as we get older, if you're between the ages of 60 and 75, you should be able to stand on one leg for 30 seconds. If you're between the ages of 75 and greater, you should be able to stand on one leg for 10 seconds. So it's a nice, quick and dirty trick that you can do at home. Put yourself on one leg, time yourself, see how long you can hold it. And if you're finding that it's less than 30 seconds or less than 10 seconds, then that's a good sign that your body needs to have a little bit of balance retraining. All right, let's talk about endurance and aerobic activities. And this is probably the most common activity that I am hearing from my patients that they're doing during this quarantine period. But what we want to make sure is that in order to help improve so many systems of our body, we want to incorporate some aerobic style activity. And aerobic activity means prolonged activity where we are getting our heart rate elevated. So the reasons we do aerobic activity is because it helps to decrease blood pressure, and it significantly helps to decrease anxiety. It also improves sleep, mood, and energy, which are three things that have been severely disrupted because of the COVID-19 quarantine. The reason that it works so well for anxiety, sleep, mood, and energy is because when we go out and exercise, our brain releases chemicals called endorphins that help to balance our chemical makeup in our brain. So what it does is it actually decreases the amount of stress hormone or cortisol, and it increases the amount of serotonin and mood boosting endorphins, so that we start to see a shift in our actual chemical makeup of the brain. When we incorporate activity like aerobic activity into our daily tasks, it really helps to bring our overall stress and anxiety level down. And we see that depression is significantly influenced. So I'm a huge proponent for getting out during the week and doing some style of aerobic activity, which we'll talk about in just a minute. The other beautiful benefit of aerobic activity like walking or biking is that it improves circulation to the body, and it also improves circulation to the brain. And it brings nutrients and oxygen to our tissues in our body, but more importantly to our brain. So when we talk about things like dementia or Alzheimer's disease, often that's because the brain is not getting enough nutrients and it's starting to build up waste product. And what we want is that blood is circulating through the brain to eliminate some of that inflammation and waste product to help reduce our chances for dementia and Alzheimer's disease. So again, significant double benefits here. So we get the lung and blood pressure related heart exercise, we get the benefits of good brain health, and then we also get the mood boosting and stress reducing benefits. So aerobic activity, I could not emphasize as being a more important thing to incorporate into your daily tasks. So examples of aerobic activities, certainly biking is a great activity. Walking is probably the number one thing that most of my patients do and that I advocate because everyone has access to being able to walk. And it's something that you can do safely within the confines of your home or in your community if you're not able to get out into the larger community. So walking is a beautiful way for us to really exercise the heart and get that circulation flowing. Certainly more in the summer months, or if you have access to an indoor pool, swimming or water aerobics is a great option because that's a nice way to mitigate some of those forces on your joints, particularly if you have severe arthritis. But I would caution that if swimming or water aerobics is your primary source of activity, that you also couple in some weight training to get some of that strength building through your muscles and joints. But again, walking and jogging are the two most easily accessible as well as influential activities that you can do to help get all of those benefits that we discussed. So as we talk about steps for a successful quarantine recovery, the number one thing is we want to make sure that we're thinking about safety. So safety means, the environment that you're exercising in. So if you happen to live alone and you're thinking about doing some balance tasks, make sure you have your cell phone right there in your pocket so that if you do have a fall, you can call 911 or a family member or neighbor. If you're going to go out for a walk and you're thinking you want to go to one of these beautiful preserves that are around us, Stroud's Preserve or the Laurels, which is really close to Traditions at Longwood, make sure you let somebody know, hey, I'm going to go out and go for a walk in the woods. So in case you don't come back because of an issue, someone knows where you are. So I put this in quotes as alert the media, which means tell a friend, tell a family member, tell your kids, drop a text, whatever it is that you need to do. Leave a note so that your cleaning lady knows where you are, whatever the case is, alert the media as to where you are exercising in the event that there is an adverse reaction. And that could be things related to the weather, or that could be things related to your physical well-being or health. Make time for exercise. And this sounds so silly to say out loud, but this is my own personal strategy is when I wake up in the morning, I write on my to-do list exercise because I'm a to-do list person. I need to look at my to-do list and cross off all the things. So, clean the kitchen, do laundry, exercise. And then it makes it so that I plan my day around accomplishing that task. Because when we think about it, nobody really wants to dive into exercise or, maybe they don't want to dive into exercise. And so that tends to be the thing that gets pushed off. Well, then next thing you know, a week has gone by and you haven't done any exercise. So it's about figuring out what your pattern is for exercise and then scheduling it in. So my particular pattern is I exercise 3 days a week. So 3 days when I wake up, I write on my to-do list exercise. And that's how I make sure that I can plan my day and get that done. We want to make sure that we're warming up and cooling down before exercise. So that might mean if you're doing an exercise program in your home, maybe you walk a couple laps around the dining room table, maybe set a timer for 5 minutes and walk around the house a couple of minutes just to allow your heart rate to increase, loosen up your joints, get your muscles ready for work. And then after you do your exercise, same thing, cool down. Do a little bit of stretching. Maybe you think about going for a little bit of a walk if you've done some strength training, just to allow that blood to circulate through your muscles. Stay hydrated. A lot of people have the misconception that they only need to be hydrated in the summer months, but actually the winter can actually be more dehydrating to the body because the air is so dry and it actually takes moisture out of the body. So please make sure that you're drinking water during the day because this will help not only maintain your blood pressure in a healthy way, but it also will provide the nutrients to your body that it needs for healing. Certainly, when you think about what you are drinking, the number one thing that you should be drinking is water. But I know from my own personal experience with my family, oftentimes water isn't the thing that people want to drink. So, maybe you put a little bit of lemon or some cucumber, some fresh mint, just to make it have that more flavorful taste without having to go to something like a sugar beverage, like a soda or a juice, or a caffeinated beverage like coffee or tea, which can have some dehydrating effects. Monitor your exertion as you're exercising. I've included here on this slide, and I'll move my face out of the way here, my favorite exertion rating scale, which is the modified Borg rate of perceived exertion scale. This is a really user-friendly tool. I use this myself when I'm exercising. Essentially, what you're going to do is, as you're going through an exercise program, you're going to periodically ask yourself, how hard am I working? And then you're going to think about a 0 to 10 scale. 0 is you're sleeping in your bed. 10 is you can't take one more step because you're completely exhausted. And you're going to think, how hard am I working? Am I at like a light activity level? Am I working very hard? When you're doing your exercises, you're going to want to stay between a 6 and 8. So you want it to be somewhat vigorous to somewhat challenging, but not very hard, not in that 9, 10 range. If you are newer to exercise, then I would recommend that you work between 5 and 7. So a moderate level where you can still talk and hold a conversation, but you're pushing yourself just a little bit to be able to get those benefits that we so desperately want. You're going to want to think about making this creative and fun for a challenge. So I know my own personal challenge to myself is exercising 3 times a week. And I want to make sure that at the end of the week, I can say, yes, I met my goal. And then think about maybe a reward for yourself. Maybe it's that you are going to binge watch a show. Maybe it's that you take yourself out for ice cream or a coffee. Maybe it's that you buy yourself a new pair of exercise tights. Whatever it is, certainly reward yourself for succeeding in your challenge, because now we get the benefits of a dopamine response, which is a very self-satisfying release within your brain. And it's like a little gift. It's every time, you get a present and you think, gosh, that's such a wonderful feeling. Or every time you get a message from a friend, it's a wonderful feeling. That's a dopamine response. So I like to put a little dopamine response around my exercise so that it makes it fun and engaging, and that I do feel that reward for my hard work. Know when to ask for help. And we're going to talk about this in the next slide, because certainly there are times when it feels overwhelming to start or succeed with an exercise program. So we'll talk next about how to do that and how to ask for help. But before I do, the most important thing about having this successful quarantine recovery and having great exercise habits is by having fun with it. So figuring out what is it that you enjoy doing. For me, I have a really quirky yoga instructor online, YouTube. Her name's Adrienne, Yoga by Adrienne. And she's really kind of cute and quirky. She says funny things. So when I do yoga, will choose to do one of her things because I feel like I'm hanging out with a friend. It's somebody that I like, and it makes it very fun for me. Same thing, if I'm going to go for a run, a lot of times I'll pick a place I haven't been because I want to see something new, or I'll take my dog because I know how much my dog loves to run. So thinking about partnering that exercise with something extra fun is going to improve your satisfaction as well as your commitment. Okay, so let's talk about when do we ask for help. Now, certainly, whether you seek help from a skilled physical therapist or whether you seek help from someone like a personal trainer, that's really up to you. I will provide a little bit of guidance to help you make that decision. But really, this is an opportunity for you to understand, okay, when are things out of my control? When do I need a little extra help? So first thing is if you're having any pain. So if you're having pain during exercise, or you're having pain with daily tasks and it's limiting your ability to do things, you're going to want to see a skilled physical therapist, because we are the movement experts. We'll look at your body, figure out what's amiss, make the corrections, and teach you, that's the most important part, teach you how to manage that moving forward so that you have control of your body and the pain. So certainly if pain is there, see a physical therapist, whether it's with us or another physical therapist. That's obviously your decision, but I would highly encourage you to seek that skilled input, because there's no reason anyone should have to live in pain. If you're not sure what to do, maybe you're like, I'm not an exerciser, I don't really have any clue how to get started. You can certainly see a skilled physical therapist or a personal trainer to help develop that program. We work very closely with the YMCA here in Kennett Square because they have a very knowledgeable personal training staff. We also work with Anchor Fitness, which is here in Kennett as well. And those would be two great resources for my Kennett community to reach out to in case they needed some guidance on where to get started. And certainly you could come and see us for a session or two, and we could build you a custom program to help maintain and improve your physical status so that you're able to do all the tasks that you'd like to and have a successful physical program. If you happen to have a very complex medical history, so maybe you have a history of some diseases like diabetes or obesity or arthritis or a heart condition, a skilled physical therapist is going to understand that medical role and how that plays into your ability to exercise. So we would be the person to see because we'd be able to teach you how to monitor your heart rate or how to monitor your tolerance, as well as teach you the signs and symptoms for when you should have additional help or medical intervention. If you yourself have had COVID-19, you may have some side effects from that disease and that infection, like shortness of breath or some persistent weakness. A skilled physical therapist is going to be able to help you remedy that situation and improve your strength and endurance while monitoring your heart rate, your blood pressure, and your breathing to make sure that we're not taxing the system too much. Certainly, one of the areas that we anticipate physical therapy growing in this post-quarantine time is in the COVID-19 area. So certainly, if you've had COVID, please reach out and we can help provide you with a rehabilitative process to help you recover from that disease. And then lastly, when to ask for help? Anytime, because it's available. Most of our seniors have insurance that allows them to access preventative care as well as address things like strength deficits and balance problems covered by their insurance. And particularly at this time of year when deductibles have been met, this is a great opportunity to come out and get the care that you need at very little out-of-pocket cost. Now, certainly that would be on an individual case-by-case basis, but overall, I like to recommend that if you have Medicare or have a Medicare Advantage plan, you have access to having a skilled provider take you through some preventative care to improve your strength, bone density, endurance, and balance. And I would take advantage of that because really the ultimate goal is that you want to have a very healthy, aging future where your body is able to keep up with all of the things that you want to do as you go into your later years. So in conclusion, quarantine certainly has both physical and emotional effects on the body. And we certainly see that as this time period is increasing, what we thought was going to be 2 weeks of quarantine now is at 9 months and will stretch through the winter. We're going to see that those physical and emotional ramifications continue. And we want to stay ahead of that. We don't want your body to feel like it has to catch up or overcome what has happened as a result of this decrease in physical activity. If you are experiencing some of the side effects of quarantine, like loss of balance, decrease in strength, pain, achiness, shortness of breath, depression or anxiety, please seek guidance because we can improve those with physical activity using some of the strategies that I shared today. If pain is a limiting factor for you, seek professional guidance. And I can't say that enough. You know, I chose this profession because I wanted to help people feel good about themselves and their bodies. And pain is one of the things that keeps people from feeling good about themselves. So I want to make sure that you have access to that, whether it's choosing us as a provider or someone else. I can help provide you with options so that you can find the care that best matches you. We're here to help. We're right here in Kennett Square near the Victory Brewing Company. We have parking that's off street, so it's very easy for people to come and see us. And we are upholding the highest COVID-19 precautions possible as recommended by the CDC. Certainly I'm here by myself today, so I don't have my mask on, but if you were to come in, everyone would be masked. We're sanitizing the facility on a hourly basis between every single patient and then doing a gross cleaning at the end of the day. We're offering telehealth if you are apprehensive about coming out into the community, we can treat you right from the comfort of your own home, and that is covered by insurance through the National Emergency Declaration. So plenty of options on ways that you can seek care and get that guidance that's necessary. So as a special thank you for joining, and because of the relationship that I have with Traditions at Longwood, I wanted to share with you my exercise recommendations, which are available here for download off of our website, reachyours.com/quarantine. You can go right onto that website and download my recommended exercises to help get through this quarantine process. And I'm also sharing my email, which you are more than welcome to email me any questions. And I often will say, it can be questions related to anything health related. So it doesn't necessarily have to just be physical therapy. Maybe you're thinking, gosh, who should I go see for a joint replacement for my knee? Send me an email. I can provide you with some surgeons that have really good outcomes. Maybe you're wondering, where's a good place to hike in the area that would be good for someone with balance problems? I know the answer to these questions because this is what I do as a career and a job. I try to make things easier for people. So send me any of your health or fitness related questions and I will happily respond back to you, so that you are able to have access to the information that you need in order to make a safe decision for you. So with that being said, I am going to open up for questions if anybody has any. There is also a chat box. If you'd like to chat your question or type your question in, you're welcome to do that. Otherwise, please feel free to unmute yourself and ask a question that way. And if there are no questions, please keep my email on file so that if something comes up over the next couple days, you're able to reach out and I can certainly answer that question. We will be sharing this presentation as a recorded link. So if you wanted to go back and listen to it or listen to it for the first time, that will be available to you. So any questions out there on the guests that we have with us now?
I have one question. To use our health insurance to do this, do we need to get a referral from our doctor or can you provide that?
That's a great question. Thank you for that. So in the state of Pennsylvania, you can access a physical therapist without a referral directly, which means you could come right to a physical therapist and we could see you and treat you for 30 calendar days without a physician referral. However, Medicare, which always makes things slightly more complicated, requires that a physician or a physician provider sign off on your plan of care. So the short answer is we need to have someone on file that we could send the paperwork to so that they could say, yes, I agree with this plan. The evaluation does not require a referral ever. So you're always welcome to come in for the evaluation and then we can work together to figure out who's the best provider or doctor that could sign off to say, yes, I agree with that plan and I'm approving them to continue physical therapy. So thank you for that.
Yeah, thank you.
Any other questions? Okay. So again, please don't hesitate to reach out via email. Take advantage of the download program. And if you have questions regarding the program, send me a quick buzz and I'd be happy to discuss that. Again, a very special thank you to Phil for organizing and the community in general for welcoming me in for this presentation today. I hope that you were able to find that helpful and certainly look forward to a very rich future together as we side by side work to improve your ability to do the things you need to do so that you have a very healthy and happy future. So thank you again for your time today and looking forward to touching base in person, however that may appear. Thank you.